Welcome back to another episode of the Fill Me In podcast, where we dive deeper into the world of aesthetics. I'm Injector Jon.
And I'm Aesthetic Nurse Nicole.
And welcome back, everybody.
Yes.
Hope you guys had a really good week. It's been crazy. This is crazy time for all of us in aesthetics. I feel like people are getting ready for summertime. So those stacking treatments and all of it are just, it's been so busy.
I know I laugh when people say like, oh, there's such a lull. I'm like, we have not slowed down.
Not slowed down. And I was actually really surprised. Like, people that are listening, I'm anxious to see like what you guys think. Like January usually is a little bit of a lull because people spend so much during the holidays. They want to save a little bit that month. Or there's just a lot of gift cards that are being used in January, but it was nonstop busy this year.
Yeah, I felt like there was more people coming in after Christmas than there was before Christmas, which was crazy.
Yeah, I feel it. And there's a lot of new faces too. I don't know about you, Nicole, like new patients coming through. And I think a lot of people just like, new year, new face, new you. Like they just want.
Well, and it's almost March. Everyone is getting ready for nicer weather. So
yeah, and all of our brides to be for this summer, this is the time to start seeing your esthetician or your injector to get you ready.
That's right. You need at least 6 months.
Yes. So today we're going to be talking about regenerative medicine a little bit more because, there's been a lot of excitement. And for those of you that are on social media and are active on social media, you guys are seeing a lot of talk about PDGF or REScence. And there's a lot of providers, a lot of people that are doing it. They're having great results. So we're going to talk a lot about that. We're actually going to go into reconstituting it, pricing, stuff like that. So that way you guys kind of have an outlet and a resource for it, because I'm getting a lot of DMs about it.
Yeah, I was going to say, Jon has had a lot of hands-on work with this product where I have not. I'm still kind of doing my research, still learning. So I'll be asking a lot of the questions and Jon will be giving us the answers. But
and the other cool thing, I mean, we're going to talk about treatment stacking as well.
Yes.
Which, Nicole, you do a lot of with your Moxie BBL, and I do a lot of with IPL erbium, microneedling erbium. So, and we all know that treatment stacking yields better results.
Right. Absolutely. And I think a lot of patients too always ask about PRP and PRF and things of that nature. So I think it'd be nice for them to learn what PDGF is and the difference. And it's kind of like you're getting even more than what PRF can give you, but you're not dealing with the blood draw and all of that too.
And I'm never going to knock PRP or PRF because it's also a great treatment.
Yes.
And I just did it the other day in my practice. It's just, it's patient preference and, we do our education. We talk about the benefits of both and we go from there.
Right. So I guess give us a quick explanation on what PDGF is.
So PDGF is platelet-derived growth factor. So basically, these scientists took the exact amino acid sequence in human DNA and then replicated it and cloned it and made it over and over again. So it's synthetically made in a lab like insulin. And it's basically right now, so REScence PDGF, so it's owned by Samuel Lynch, Dr. Lynch, Regenerative Medicine. And REScence is basically used and it's FDA approved topically over compromised skin on top of microneedling, CO2 skin resurfacing lasers, things like that. And when you get your REScence PDGF package, you open it up, you see 5 little syringes filled with pure PDGF BB, okay? And then you see a little serum, and it's a hyaluronic acid serum, and it's uncross-linked HA serum that it comes with. And that HA serum is combined with the PDGF BB, and it's used topically over RF microneedling. It's going to be used in conjunction while you're doing skin pen microneedling, used as a glide, right? Because the HA serum can help to glide that skin pen right over the skin. Or it can be used over CO2 skin resurfacing. And they're finding that PDGF is yielding better and consistent results, more than PRP and PRF. And the reason why is that when it's compared to PRP and PRP and oh my God.
Say that 10
times fast. Oh my God. So when it's compared to PRP and PRF, they're finding that the growth factor concentration is 1,000 to 300,000 times more potent than PRP and PRF.
It's insane.
Right. So kind of people are like, well, why aren't we using just PDGF instead of PRP? But the thing is, we've been raised with kind of, PRP and PRF. It's become our baby over the years. So this is something new. People are obviously nervous to use it. But it's going to be yielding better results. It's going to increase your collagen production. It actually targets collagens 1, 3, and 6. There's a 200 to 400% increase of those different collagens, which is incredible. And the other amazing thing that it does, and I think that it adds to the glow of the skin, is that it upticks the hyaluronic acid concentration within the skin by 800%. I
Wow.
mean, it's incredible, right?
Yeah.
So it's really, really great. I've done it, topically after RF microneedling. I am very pale skinned. My ethnicity is French. I'm Irish. Yes, you too, Nicole.
Me
So for
too.
people like you and I, when we do microneedling, we might have a little bit more downtime than the normal person. Like usually I'm red for like 2 days,
Yeah.
and then finally pink on day 3 and then back to normal. But with PDGF or Essence PDGF topically afterwards, by the next day, it literally looked like I had nothing done and I could just put tinted SPF on.
Yeah, and that was crazy because I know you and I know how red your skin
Oh,
can get.
I'm so reactive.
When I saw that, I was like, "Oh my god, he's
And
healed."
we'll have to show like my little reel that I made about it back, I think in December or so. It's on my Instagram, so you guys can reference that. But it's really, really great. And it really does yield, better results that I've seen with PRP, but it's not to knock PRP. The other really interesting thing about it, and I actually was a part of the webinar that Wasim Garbia and Erica Berry did about 2 weeks ago that went over everything about Essence PDGF and then PDGF BB. So what they noted on that webinar with Wasim and Erica was that PDGF is actually more sterile than PRF and PRP, which is very interesting because it's man-made in a lab, right?
Yep.
Everything is controlled, whereas with PRP, it's autologous, right? So we're literally drawing your blood, we're taking it and putting it in a centrifuge, we're spinning it, then we have to take it out very, very sterilely, carefully, right? And then injecting it. So
right.
when it's made in the lab, it's more sterile. So
And
that's something that I mentioned to my patients.
right, if you're someone that maybe doesn't have as many growth factors in your blood, like if you maybe your liquid gold isn't as good as someone else's liquid gold.
That's the other thing.
Right. This is a way to streamline that and you get those growth factors without having to worry about all those variations.
Exactly. You're going to get you're knowing that you're getting consistent growth factor, and that's the thing. And you're getting thousands more than PRP and PRF, which is great. Hey guys, just popping in to remind you to like, subscribe, and hit the bell for notifications. Also, don't forget to follow us on Instagram, Injector Jon and Aesthetic Nurse Nicole. Thank you so much for watching. And if you have any questions, leave it in the comment section.
Yeah. And I know that I don't carry PRF. I don't think you do either, right?
No, just PRP.
Yeah, same. But I know from my colleagues that do carry PRF that it is quite the task to make.
Yeah. And PRF Easy Gel too. It's quite the task.
Yeah. So it's definitely, this I think would take a lot of time out of that equation. So curious to see, but tell us about the drama because we're using it as a little bit more than topical now.
Well, naturally, we're like, wow. I mean, this is topically used, right? And you're getting these amazing results, like improvement in skin texture, skin hydration. I mean, it looks like you had 1 million syringes of Skin Vive put in your skin afterwards. It's just this beautiful glow. And that's honestly the reason why I think I'm glowing so much right now. But basically, a lot of us are starting to use it off-label, which we do a lot of things off-label. We just had the FDA approval for Platysma bands for Botox Cosmetic, which is incredible. But we've been doing Platysma bands for years. I mean, we're doing Master Botox. That even hasn't had an FDA approval yet.
Right.
So there's a lot of things,
and we're not the only field that does off-label. You can use blood pressure medication off-label for anxiety. There's so many fields that use medications off-label.
We all know that Wellbutrin helps with depression, but it also is used for smoking cessation.
Right.
We know that lidocaine with epi, like if someone comes in with epistaxis, which is a bad nosebleed in the hospital, the epinephrine that's in it off-label, it helps to vasoconstrict and stop a nosebleed.
Yeah.
I mean, there's a lot of different things that we do off-label. So basically we're thinking, wow, if this is great, if this is used wonderfully topically, why not try injecting it under the skin? More specifically, the under eye, because it's platelet-derived growth factor. And we've been using platelet-rich plasma, right, to stimulate collagen and improve hollowness, darkness, crepiness under the eyes. So we are now using it under eye for under eye injections, off-label, as well as in the scalp to stimulate hair growth, which I got as well. So I've had my scalp injected. I've had my under eyes injected. I've actually had it off label as well, mixed with Skin Vive as well, skin booster. And I've had Alicia, my RN injector, inject it in my skin as well. So this has been a really fun time in aesthetics, just and especially in the regenerative medicine standpoint, just playing with this product and just seeing wonderful results and a lot of happy patients.
And I do feel like you just look filtered, like in the best way. And I know we hate using that term as injectors, but
Yeah.
it's like Skin Vive. I always explain it to patients as like icing on the cake. It's going to catch some of those like finer lines at the surface or little spots that we might miss with deeper filler, but it gives you that very smooth, very luminous appearance.
Yeah.
So I can only imagine with the PDGF in it.
Well, it's crazy because it's regenerating everything but nerves.
Yeah.
So skin, fat pads, all of it, and is being regenerated, which is wonderful.
Yeah, it's amazing.
And the whole process, a lot of people want to know the process of how it's stimulating collagen.
Yeah.
So basically it's promoting cell proliferation, which is the formation of new skin cells, fibroblast activity. It's improving blood supply through angiogenesis, which is the formation of new blood cells or new blood vessels from existing blood vessels. It's kind of like when you have a cut on your leg, right? It stimulates the whole healing cascade and it forms new blood vessels to basically rescue and send platelets there to stop the bleeding and then heal, right? It's very similar what it does when it's injected under the skin. And then also topically when it's going through those little microchannels after microneedling, right? To promote the whole healing cascade.
And I think too, we can put maybe your series of photos, but as you're going through that, as the patient, you definitely do notice that redness, almost like a purpley redness appearance.
Yeah. And I will tell you though, so I did that. So what we're learning with PDGF under eye is that it's supposed to be injected deeper in the tear trough. So it's a deeper injection.
Okay.
And I use a combination of cannula and then also needle. But with the cannula, kind of like infraorbital hollows, right? With Volbella, I'm basically making a little poke with the needle and then I'm using a cannula and I go right to bone and I'm gliding that cannula right on bone into the deeper tear trough. And when I tent that cannula up like in the tear trough area, I don't want to see the outline of the cannula. So I want to be deeper. And the reason why is that kind of like you'll see like in the pictures that we show you. So I had some angiogenesis, which is redness. Okay. And some people may freak out, but it's the normal. I knew it was normal. I knew it was going to go away. And that's something that if, patients are injected a little bit more superficially, we educate and say, you're going to have a little redness. It might last up to 21 days. And then it will go away. So we're noting to inject deeper into the tear trough in the under eye area to lessen you having some of that redness that's there. The other thing that can happen is some swelling too. If it's injected a little bit more superficially, you can still have a little swelling if it's injected deeper, just because it's an area of lymphatics too, right? But just know it's working. It's all a part of that healing cascade and the angiogenesis and the cell proliferation, and it's a beautiful thing.
Right. If there was no reaction, we may not get as much of a result, that we expect something to happen.
And we'd be concerned. We'd be like, is it doing anything?
What's going on in there?
Yeah. And a quick backstory too, and it's very short about PDGF. It's FDA approved to treat diabetic foot ulcers, to regenerate skin tissue with diabetic foot ulcers. It's also been used to augment bone by orthopedic doctors, which is really, really cool. It's FDA approved for injection into, I think, knees, the spine as well. So it's being used elsewhere to promote stem cell activity and regenerate new cells.
Well, I'm like so excited to see where this future takes us of like regenerative medicine, because
me too.
Like a lot of the aging in our face does happen from bone loss too. So if these things can be placed very deeply or onto the bone,
right on bone.
Right. If there's a chance that it can help regenerate some of that too in the future, I mean, that's incredible.
And I think doing this like earlier rather than later, we always say it's easier to prevent than it is to correct, right? So if you're starting these things in your mid to late 30s, early 40s, it's so much better, and it can help to, maybe augment bone or regenerate skin tissue and things like that. It's wonderful.
Right. How many sessions do people typically have to go through for?
Yeah. So for under eye injections, what we do is it's a little bit different than PRP and PRF. Usually with PRP and PRF, you bring them back in 4 to 6 weeks. It requires 3 sessions spaced out 4 to 6 weeks apart. With PDGF, we're doing injections 8 weeks apart. So a little bit further, because you're having the peak of that collagen production is up to that 6-week mark. So if you start injecting it a little bit too soon, right, at that, especially if you bring it back at that 4 to 6 week mark, they're going to have more swelling, they're going to have more
Mm-hmm.
angiogenesis. So it's better to wait 8 weeks, so that way they're completely healed, and then you can then obviously see how much hollowing, how much darkness and things like that they have, and then treat accordingly.
Right. So kind of let them get back to a
Yes.
baseline of
Hmm.
close to a baseline, and then
And
treat from there.
how I'm wording it with my patients is basically, we do say if you have severe hollowing, we do it once, I bring you back, you're definitely going to need a second treatment.
Mm-hmm.
But then I want to bring them back 2 months later, reassess them. I want to see if they're happy. I want to see if I'm happy. If they're happy with it, we leave it alone. If they need a third treatment, we do it again.
Mm-hmm.
So I think it's very patient specific.
Yeah.
And yeah.
I'm curious too, like acne scarring, as I feel like I get a lot of
Yes,
patients for
Nicole,
acne scarring. Yes. Yeah. Like,
I think it's wonderful.
yeah. So you can almost kind of break up that tissue and do a little bit of that through
Mhm.
there to help kind of regenerate that tissue too.
Yep.
'Cause
Yep.
I feel like acne scarring is one of those most debilitating
Mhm.
things, and there's not much you can do for it. Skin Vive has been my major thing now, but
Yeah, and like I said, I had Alicia, my RN
Mhm.
injector, inject me with a Skin Vive and mixed with PDGF BB. All right. And again, we are not, and this is the whole, I think, confusion. And this is what I want to talk about. When we are injecting PDGF BB, okay, which comes in that Area Essence package, okay, we are using the PDGF BB and we're mixing it with bacteriostatic saline. We are only using the HA serum, the uncross-linked HA serum it comes with, in combination with PDGF topically, okay,
Okay.
over RF microneedling, over microneedling or CO2 skin resurfacing. So that HA serum it comes with is only mixed with PDGF when we're using it topically. Okay.
Got it.
So when we're injecting it under the eye or in the scalp, or there's some injectors that are injecting it into the neck to improve the neck lines and things like that, or even in the smile lines, we're mixing it with bacteriostatic saline.
Mm-hmm.
Yep. And we have to dilute it with bacteriostatic saline because it's so potent. Like,
Right.
that you think it's such a little syringe it comes in, but it's so potent. There's 1,000 to 300,000 times more growth factor concentration than PRP in
Right.
it.
Right. So you're not wanting to put too much of that in one spot
Right.
either. Yeah. Yeah.
Yep.
So when you
Mhm.
dilute it, how much would you say, like ml wise,
Yeah.
do you
It,
have? And
so usually what I do is I draw up 1.5 cc's of bacteriostatic saline, and then the PDGF BB has 0.5 cc's in
okay.
it. Okay. So I mix 1.5 cc's of bacteriostatic saline and mix it with 1 syringe of PDGF BB, and it yields 2 cc's of product.
Okay.
And then I do 1 cc
Mhm.
of that mixture per eye. And lately, what I've been doing is doing 0.5 with cannula to this part, the medial tear trough,
Mhm.
and then keeping the last 0.5 and then going to that lateral orbital rim and doing
Some
needle to
needle.
periosteum
Okay.
injections. Yeah. Yeah.
I don't know if you're going to know the answer to this one, but are
Mhm.
we worried about occlusions of any
No,
sort? No. Okay.
we are not. And that's and like I said, I just watched the Wasim and Erica
Mhm.
Berry webinar 2 weeks ago, and it makes sense. I
Right.
mean, it's you're mixing it with bacteriostatic saline, and PDGFBB is not filler.
Yeah.
It's literally like what
So it's
more.
a very different consistency than filler.
Yes.
Okay.
Yes.
Mhm.
Exactly. Yep. It's like water.
Right.
It's like more
Right.
water
So
soluble.
there's
Yeah.
nothing really to clog.
No. No. So you don't have to
Right.
worry about a VO, a
Mhm.
vascular occlusion.
So that's great.
Which
I
is
mean,
wonderful. Yeah. And other people, I mean, Wasim is injecting it and he's already posted about it into the forehead,
Mhm.
just to kind of, as we get older, we get that little dip here in that area of the frontalis. And then people start getting those little creases above their eyebrows that we've talked about before.
Right.
Other areas then like the under eye and the scalp that, people are injecting it is the neck.
Mhm.
And then also the forehead as well. Just to kind of, as we get older, we get that little dip, like I said.
Yep.
And injecting the PDGFBB into that helps us stimulate new skin tissue and lessen that dip and make
Right.
the forehead look more youthful as well.
It's incredible. And it's like, that's great because I feel like too, the forehead is an area that we for so long have had nothing we can do. I
Oh
mean,
my gosh, I know.
there's plenty of injectors that are willing to do filler there, but
Mhm.
I'm not one of them.
Mhm.
So
No, me too. I don't
this,
either because of the worry of a vascular occlusion.
right.
I
Like
know.
there's so many little vessels up there and like
Mhm.
why worry about the dent in your forehead when you could go blind? That's just how I think about it. But this is exciting.
Right.
This is an
It's very exciting.
yeah, like we're making a lot of advancements in this field, and it's very exciting.
We really are. And also what I'm doing with my patients, and I know other providers are too, is they're treatment stacking. So I'm, bringing someone in, we're doing, they're complaining of crepey skin, right? Dry, crepey skin, fine lines under the eye, and hollowing, right? So I'm doing PDGF under eye. And then a week later, bringing them back. And then I'm doing RF microneedling or an erbium skin resurfacing laser, focusing on the under eye, and then putting the PDGF, the area since PDGF, right? So
Right.
PDGF mixed
Yep.
with the HA serum it comes with topically over it. So it's like treatment
Yes.
stacking.
Right.
So you're
Yep.
targeting underneath and then on top, and it's
Right.
incredible.
You're getting every layer.
Yep. It's wonderful.
That's amazing. I honestly can't wait to see where we are in a few months with this and before and afters and all that. But just seeing your progress with it, I mean, it's been crazy.
It's been really cool. And you have to trust the process.
Right,
And, and one thing I want to point out, when you see my pictures, you'll note my angiogenesis, the redness was there. And it's because I actually treated myself. Well, Alicia injected it more superficially because I wanted to see that. And I did have the angiogenesis. It lasted up to, I would say, like 10 to 14 days. But by the 21-day mark, the redness was gone. I only had swelling like day 6, day 7 or so. And then it quickly resolved. It was kind of crazy.
Yeah. Because I do think people might not be quite used to that because they're used to PRP or they're used to filler and
it's more superficial, right?
You're not going to have
subcutaneous
that redness, and you're not going to have that prolonged redness and swelling, where with filler maybe, but especially with PRP, you won't. So I feel like that's a little bit of something you have to make sure you educate to your patients. Yeah. But again, it's for a reason. We're getting 100%. A response, and it's causing the tissue response and the cell response. So we almost need that to happen in order to see the change.
And I'm doing this, like, I had a patient the other day that came in and, she had hollowness that extended into her anterior medial cheek. So I did juvenile voluma. We did a syringe here. We did a syringe on the other cheek, which obviously helped to support the underlying ligaments of the under eye. And then I did PDGF after that.
Yeah, right? That's so funny. That was going to be my next question. Do you ever do them together?
Yep. And I did that for a patient, and so far so good. Everything's great. But you have to, like, if you're that hollow, you have to treat the cheek. Right. I mean, right? Because it has to blend right into the cheek.
Exactly. Yep. Yeah. And that's, again, another really hard place to treat
100%.
Because with filler, you can end up looking very puffy, or you're too superficial, and it just, you can get lines and all that. So, so this is, again, exciting advancements.
It's exciting. And, obviously, I still do under eye filler. Like, you have to obviously be the right candidate, but I feel like maybe 15 to 20% of the patients that come in wanting under eye filler, I actually treat. But what's so great about this too is you can have puffiness already, like in allergies, and PDGF is great for you, or PRP is great for you, right? That's more of a better option for those people.
Right. Absolutely. Yeah, it definitely still, I guess, how would you determine if you want to do PRP versus PDGF on someone?
So I think it's patient preference and all how you educate the patient. If they're leaning towards wanting their own growth factor in stem cells, right, and a more organic method, then I think we'll go the more PRP route. They'll come back every 4 to 6 weeks. They're definitely going to need at minimum 3 treatments. They might need 3 more, because I do feel like, right, like, I mean, 3 is great.
Yeah, but it's not.
Sometimes they need 3 more after that.
Yep.
Whereas the PDGF, it's got 1,000 to 300,000 times more growth factor in it, right? So it's going to be a little bit more consistent. So I just tell patients, like, it's one or the other.
Right.
PDGF might act quicker. You might see your result that you want quicker. You just have to be more patient with PRP or PRF.
Do you have to worry at all with, like, thin skin? Because I know, like, if I'm doing,
I think it's great for thin skin.
Yeah. So it's not anything like, when you're worried about, like, under eye filler and you're like, oh, this person has way too much thin skin, like, there's no way it's going to look good.
No, I think it's really good for those people. I think PDGF is more for severe anti-aging. Like those patients that come in and they're just super crepey, very wrinkled, sun damaged. It's really good for them.
Yeah. Well, I guess if you think about it too, with those patients, we may opt for something like Sculptra.
Yeah.
And at the end of the day, this is similar.
One thing I wanted to bring up, and it was really cool in this webinar, we were able to, there were so many people on this webinar with Wasim and Erica, and we were able to ask questions. And one person asked, like, what about mixing Sculptra with PDGF?
Mm-hmm.
And here's my thing, like with that, like it would almost be like stimulating too
Too
much
much. Yep.
proliferation, and there would be almost too much inflammation going on because Sculptra already causes,
Right.
things like that, like, by causing, you know what I'm saying,
Yeah.
Nicole?
Yeah. It would be overkill. Yeah.
Overkill.
Yeah.
And I think
Yeah.
I would worry by mixing PDGF BB with Sculptra, it might cause more nodules or
Mm-hmm.
more issues,
Right. Yep.
and I could be wrong, but
Right. But
that's just my opinion. So I don't think I would mix it.
no, I agree.
Think
My thought process would be the same way. Yeah.
Mhm.
Yeah. Like you just don't want to risk that.
Mhm. So let's talk about treatment stacking.
Yes.
Yeah. And, Nicole, we always say that, treatment stacking yields better results than just doing one method, like an IPL,
Yep.
a microneedling, right? So what do you do in your practice that is treatment stacking?
Well, it's so funny because everyone always asks me, well, which laser should I do? I'm like, well, if you can, you should do BBL with Moxie. Doing the two together, you're going to get the best result because BBL is helping heat the skin, generate that collagen. It's getting rid of the pigment. And then Moxie is more of that topical. So textural, it's still going to help with pigment to an extent, but they work together to give the best result.
Right.
So definitely, I mean, we do a ton of treatment stacking, obviously filler and Botox with all of our skincare procedures. But I like to always say, like, and I think we talked about this with Olivia on one of the podcasts, but microneedling in the summer, your lasers in the winter, like, there's always something you can be doing. And I think you have to be stacking a laser or a microneedling on top of your Botox and your filler. If you're not, there's no reason to be doing it.
And there's more downtime and we get that. Right. But yeah, summer safe options are Moxie, right? And microneedling.
Yep.
Those are safe to do.
Absolutely.
Even if you're tan.
Yeah. You're not worried about pigment or anything like that. Yep.
Yeah. Yep. And I know we do IPL with Erbium. We don't have Moxie BBL yet, maybe down the road. And then microneedling with Erbium. We've been doing a lot of that.
Yeah.
Oh my God. Patients are seeing such great results. And now that we have Area Essence PDGF, oh my God.
Yeah.
That on top of it, it's just incredible.
Yeah. Cause we stack with the PRP now.
Yes.
So
I mean, you can also do that. And we offer that too to our patients as well.
Right. It's just another option, but yeah, I'm excited to keep seeing the PDGF differences and hopefully bring that on in the future.
Yeah, I love it too. And I think what's so exciting about this field is it's just ever changing and it's just so exciting,
It really is. It really is. I know, because it's going to be 2025 is definitely the year of regenerative medicine. And it's just also the year of wellness. We're not just worried about weight loss anymore. We're worried about hormones now. We're worried about the aging from the inside, like NAD plus and all of these things that we can be doing to help our cells, and not just cells that relate to beauty, but cells that relate to overall aging. Yeah. So it is exciting where our field is going.
I totally agree. The one thing I do want to mention about PDGF BB, if you are injecting it off label and you're mixing it with a bacteriostatic saline, I would highly advise against injecting it like superficially, like superficial blebs under the eye and things like that, just because I think because of the uptick in hyaluronic acid concentration of 800%, you're going to end up with little bumps and things like that. And also like cell proliferation, too superficial.
I'm glad you mentioned that because I just saw a viral TikTok of a lady injecting herself, and she didn't say what she was injecting, but it looked similar to something like
maybe either salmon sperm.
I think it was the PDRN, like those, like the, but like, still, you don't want to just take a video that you saw on TikTok and roll with it.
That's it. You're like, ooh, we can do that with salmon sperm. Let's do that with PDGF. But you have to know the science behind these products. And the one thing I've found out is that PDGF, I mean, it actually has more published studies than filler, which is kind of crazy.
That is crazy.
Yeah. And, the Area Essence reps are wonderful. I mean, the minute I asked for more research, they sent me published studies and it was just so great. It was great support. Right. And I think for those listening that love regenerative medicine, that want to learn more about it, some of the leaders in it, I think Shino Bay, he's wonderful. Leslie Fletcher as well. And then also Julie Kaplan. She's always been wonderful. I know I'm missing more people. Nicole, do you have any other people that you know?
No, I would say Julie Kaplan's the one that I've seen the most on, especially this topic, really showing her before and afters and explaining the product. And she's definitely one I would look into.
And then Dawn Segrillo. I think,
yes. Yeah. Yeah.
too. I think
Yep.
she does as well.
Yeah.
I know she's doing PDGF in her practice.
Yeah.
So
And I feel like
believe.
Shino Bay he's always doing something. So I follow him
He's-
like,
yes, it's so, he just makes things so exciting,
yes.
you know,
Yep.
so inspiring.
But no, I think it's great that you've been not only doing it on your patients, but you took the time to try it on yourself first and really learn and
course.
research the product and know how it reacts and see the changes that, you know, sometimes you bring these products on, you don't want to just throw it in a patient and hope for the
Right.
best, you know, like you really try it out first and again, ask for the research and see the studies and,
Mhm.
and all
Yeah,
that. So
These treatments should be done on
Yeah.
us too.
Yeah.
So that
Yep.
way we know, you know, the whole healing process, what to
Mhm.
expect, and we can better educate our patients.
absolutely. So
Yeah, I always say I would
yep.
never offer a treatment that I wouldn't try.
Yep. No, it's
Mhm.
so true. You got to be the guinea pig first.
Yes,
Yep.
100%.
Yeah.
Yeah. Well, this was so fun.
Yes. Yeah. Thank you for hopping on.
Yes. And if you guys have any questions, like please like shoot us a DM on the Fill Me In Pod
Mhm.
Instagram or shoot us a DM privately as well. But this was great. And I can't wait for all of the comments on the reels, like, you know, about this, because I think that'll stimulate a lot of conversation.
Yes.
Which is great. We can all learn from each other. This is a positive environment, right? So yeah.
That's right. We're learning every day.
Yes.
We want the questions. We want the answers. We want everything.
Nicole.
comment away.
Comment away. But thank you guys so much for tuning in to another episode of the Fill Me In podcast, where we talked about regenerative medicine, stacking treatments, and PDGF.
The very exciting PDGF.
Yes. I'm Injector Jon.
And I'm aesthetic nurse Nicole.
Until next time, love
Bye,
you guys.
guys.